a speaker join us from the National Accreta Foundation and herself a survivor. So we're going to have this session brought to us by Alexis Carena. Alexis, thank you for joining us today. Alexis is a survivor of placental Accreta, which required life-saving surgery and blood transfusions during her son's birth. Her patient story has been shared in Innova's Iron Health magazine and at blood drives in the Washington, D.C. area. Alexis focuses on increasing awareness of placenta accreta and other life-threatening pregnancy complications that rely on the availability of donor blood through regular blood drives and the advocacy platform Heroes for Moms that she founded. Alexis also has personal experience with Müllerian anomalies. I'm not sure if I've said that correctly, Alexis, so please feel free to elaborate. But it is a congenital disorder of the female reproductive tract. In addition to her maternal health advocacy work, Alexis has spent her career in the enterprise software industry, working in marketing and communications. So we welcome you, Alexis. Thank you for being here.
Thank you. Thank you. Thank you, everyone. And thanks so much for the introduction and the invitation to join today's webinar. I'm really honored to be here.
Alexis, before I get you to start, I'm sorry to interrupt. I do have to read this statement. It's regarding the educational credits that are associated with the webinar. So I'm just going to read the slide that's up on screen. It's a disclosure. The activity has been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for Continuing Medical Education, through the joint partnership of the Doctors Company, thank you, Amy, and Georgia Perinatal Quality Collaborative. The Doctors Company is accredited by the ACCME to provide continuing medical education for physicians. The Doctors Company designates this live activity for a maximum of 1 AMA PRA Category 1 credit. Physicians should claim only the credit commensurate with the extent of their participating activity. The Doctors Company would also like to disclose that no one in a position to control or influence the content of this activity has reported relevant financial relationships with commercial interests. I will also add that the Georgia Board of Nursing does accept AMA PRA Category 1 credit, so that will be applicable for all nurses who take part in this activity. Thank you very much. I'm sorry, Alexis, go ahead, you have the floor.
That's okay. Thank you. Thanks again for inviting me to join today's webinar. I'm honored to be here and tell you a little bit more about my experience surviving my son's birth. I'll start with sharing the details of my story, and then I'll wrap up with some suggestions and tips on how to support patients and families of those impacted by a serious childbirth complication. Next slide. Just some background about me. I live in Northern Virginia, right outside of Washington, D.C., with my husband, Chris, and 6-year-old son, pictured here. And in 2012, I survived a pregnancy complication called placenta accreta during my one and only viable pregnancy. Of course, it definitely was not how I had planned my son's birth. There was no going into labor. There was no vaginal birth. There was no holding my son right after he was born. I didn't even get a chance to pack a bag to go to the hospital. It was definitely not how I had planned it to be. I was thrown into just a traumatic situation where I delivered my son earlier than planned, and my family had to take care of pretty much all the preparations. Having a child is supposed to be one of the most exciting times in your life, and unfortunately it was one of the scariest. So when I became pregnant with my son, I was a nervous wreck. I had actually experienced 2 miscarriages 2 years earlier, and I found out my miscarriages were actually caused by a uterine septum, which is the Müllerian anomaly that you mentioned. And I had 2 surgeries to resect the septum. Along with 2 surgeries from the miscarriages, I had a total of 4 uterine surgeries prior to the pregnancy with my son. So from the things I had read and learned, I was concerned about incompetent cervix due to having 4 surgeries, so I advocated to be closely monitored. And sure enough, my cervix shortened and I was hospitalized. I was eventually sent home, but was put on modified bed rest for 2 months, and I was okay with that. I definitely didn't want to deliver a preemie and wanted to avoid preterm labor. Next slide. So about 5 weeks before I was due to deliver my son, I had an ultrasound, and it was there that my placenta looked suspicious. There seemed to be no separation between the placenta and my uterus, and that meant that it was possible I had placenta accreta. And with the suspicion, I was sent to have an MRI. I was absolutely petrified to get an MRI while pregnant, definitely not routine. And I was really scared what it might do to my son, his health, and all the loud sounds and all that. And I, of course, was worried about the results. And a few days later, unfortunately, I found out that it was pretty certain I had Accreta. Next slide. I didn't know what a placenta accreta was. I had never heard of it. And I quickly learned that it was my placenta growing through my uterus, and it was a pretty serious complication. The placenta was growing through the uterine wall. It can sometimes invade the muscular layer of the uterus. It can sometimes even grow completely through the uterus, and I think some of you may already know this, and can attach to other organs like the bladder and the bowels. And this tends to happen in patients who've had some kind of damage to the lining of their uterus, allowing the placenta to attach more deeply. And it's it's most common in those who've had previous C-sections. But funny enough, I hadn't had any. I had a history of 4 surgeries, but not C-sections. But I was at risk, and I was completely unaware of it. Next slide. While placenta accreta used to be rare, it's actually increased over the years with increased rates of C-sections and other surgeries. Accreta now occurs in 1 in every 272 pregnancies and has quadrupled since the 1980s. C-sections are definitely the largest contributor since it's one of the most common surgeries in the U.S. But in cases like myself, it can be caused by other surgeries as well. Next slide. So placenta accreta was definitely an overwhelming diagnosis. I found out that the outcome is pretty much determined by the level of care and readiness the patient receives. And I knew I needed expert care immediately. And I was transferred to another hospital where they can handle a situation like mine. Because the fear with placenta accreta is that it's a ticking time bomb. There's definitely a risk of hemorrhage at any time. But I lucked out that there was a hospital so close by where there were doctors and nurses equipped to take care of accreta patients, where my complicated delivery would be planned and well supervised, and importantly, where safe blood products would be available. My new group of doctors actually started putting together a plan together with me. I would deliver immediately, and they would prepare for a hysterectomy. But as you all know, a hysterectomy on a pregnant woman is pretty risky. There's still a risk for massive hemorrhage. It would definitely be a complex surgery with many specialists involved. For an accreta surgery, there could be up to 21 or more specialists taking care of a mom and baby, included those listed here. Overall, I had a few things working in my favor. I was almost full term at 36 weeks. Many accreta patients deliver earlier and their babies spend time in the NICU, but I lucked out. I was further along. Also, I was to deliver immediately. I didn't need to spend really any time on hospital bed rest. There are a lot of accreta moms that spend months in the hospital on bed rest awaiting their delivery date, as their accreta is found earlier in their pregnancies. And finally, and probably most important in my case, I found out that the hospital I was at was one of the best for accreta, only 20 minutes from my home. I was definitely lucky because there are many other accreta moms who live hours away from the closest hospital that can handle Accreta. But regardless of the positives, I was absolutely terrified. I still had to make it out of surgery without losing too much blood, and I would end up with a hysterectomy, unable to carry more children. I was definitely put into survival mode. I had to think about all the things I had to get done before my surgery. I actually hadn't even picked my son's name, and obviously had to do that fairly quickly. And my husband and I spent the day or two before the surgery working on that, and also buying the things that I needed at home. I didn't have anything ready. I thought I had a whole lot more time. I thought I had 4 more weeks. Next slide. So the big birthday. On the big day, my surgical team decided that I would actually be awake for the entire surgery. I would receive a spinal, and that meant I got to hear my son's first cries. I am extremely grateful for that. And I also got to hear the dreaded words of my OB, who said that my placenta was not coming off. I got to see my son for a quick second before he and my husband were ushered out of the room, and the gyneco-oncologist stepped in to perform the hysterectomy and control the bleeding. But I remember everything. Even 6 years later, I remember everything from those 3 hours in surgery. I definitely remember the discomforts. I was strapped down with my arms straight out. I was freezing cold. I was trying not to look at the reflection above me because there was a light there, and I was convinced if I looked at it, I would see my open abdomen below. And I was trying not to listen to the doctors as well because, of course, they were talking about what they were seeing and the clamping and what to do next. And then I heard the call to the blood bank, and that's when I knew I needed blood, and I was wondering how much. But there were definitely many comforts as well that I remember. The anesthesiologist stayed by my side the whole time. They were so comforting. They asked me how I was doing throughout those 3 hours. They played music for me. I remember that music. They held my hands. They talked to me. They helped try to keep me warm. They asked me questions to keep my mind on other things. And those are the things that I really appreciated. Those are the things that stand out during those 3 hours. And when I was finally reunited with my husband and son afterwards, I had survived. My husband was sitting quietly next to my son in his bassinet, and they had been alone together for 3 hours, just sitting beside each other. And it was actually because my husband was petrified to pick up a newborn by himself. But the nurses checked in on him occasionally, and he really, really appreciated the privacy. He later on told me that that's what he wanted, that he wouldn't want it end differently. And then I finally got to hold my son for the first time, and I was eventually transferred to a room to recover. But it wasn't in labor and delivery. It was in a different section of the hospital, and it was eerily quiet, and I remember feeling quite isolated there. There was no nursery support. There was no postpartum support, and I just so badly wanted to be like all the other moms in labor and delivery recovering from birth, and that just wasn't the case. And, you know, with the recovery, I was completely bloated, my face twice the normal size, my feet and calves were in the compression pump wraps, and my swollen abdomen, looking down at it, looked like Frankenstein, and the fluid coming out smelled like fruit punch. I couldn't sit up. I couldn't pick up my son. The pain was just really, really unbearable. Next slide.
I've heard you're getting drunk with Lisa when talking about it.
But I was eventually transferred to labor and delivery, where I recovered for the rest of my time. And that's actually where I was treated with so much comfort and compassion. I received wonderful nursery and lactation support. I got photos taken with my son like this one. I knew I would never get that opportunity again, of course. And I tried really hard to forget about how I got there and just wanted to be treated like any other patient there in labor and delivery. Next slide. So then I returned home, and physical recovery continued to be pretty rough, and I struggled returning to work 3 months later. It was way too soon. And I struggled a bit with breastfeeding. I had excruciating back pain for over a year, actually. There were months where I couldn't get out of my bed by myself. I eventually found out about massage therapy for the adhesions in my abdomen, and I seeked out yoga to strengthen my core, and all these new things that I had found out about that I had no idea even existed. But I think long-term, what I wasn't really ready for was the emotional and the mental recovery. And I didn't know what to expect. The sadness that this was my first and last child and it wasn't my choice. I had significant survivor's guilt. I was alive, but others with my condition weren't. And I especially felt quite alone in the experience because it was so traumatic and I didn't know anyone else who had experienced something like it. And at the time, I really didn't understand how traumatic birth can cause so much distress and depression, and that stress and anxiety, even PTSD, were totally normal to be seen in patients like this who've had an experience like this, and that it may continue for years. Next slide. But somehow I finally came across my my first Accreta support group, where I found hundreds of other women, unfortunately hundreds of other women who had gone through a similar experience, and some definitely more traumatic and more devastating than mine. But I realized I wasn't alone, and that's actually also where I realized I needed to be grateful that I was alive. And there were definitely other survivors as well that wanted to do something and felt the need to give back and be a part of that. And one of the avenues was donating blood. And given that many of us were alive due to blood transfusions, and I honestly had no idea that one of the biggest uses of donated blood was for mothers during childbirth. I hosted several blood drives, and I continue to do so, which I call Heroes for Moms. And my son comes with me, and we make great signs like this to encourage people to donate. And through the support groups, I've found other local Accreta moms who join me, and we team up, and we're able to turn that table and make sure blood is available for future Accreta moms. And while doing all this, we're raising awareness of Accreta and its risk factors and hoping that we can prevent it happening to others in the future. Next slide. So when I think back at what worked and what I was grateful for, there are a few things that stand out about the patient care I received. First, I really appreciated that the doctors didn't sugarcoat their words. They were very upfront and honest with me. And I specifically remember the morning of my surgery and my son's birth that my anesthesiologist straight up told me that I could die. And it was the first time I had heard those words. I mean, I knew it was definitely possible, but I just needed to hear it. And my husband definitely needed to hear it, and because it was reality. And you know, patients like myself, we have to be capable of handling that kind of truth. And the other thing I really appreciated was that the nurses listened. The whole time I was in labor and delivery recovery and with my husband and with my son, they listened and asked questions. They wanted to know how my pain was, and they really listened to how I was feeling and talked about those solutions. And also, I was just really grateful for the care and the support that was advocated for, because not every postpartum case is the same. And while it was isolating for me to be outside labor and delivery at first, I realized it was the best place for me at the time because of the type of surgery I had and my condition. But it's overall just advocating for the right patient and nurse ratio and the right support for the condition that the patient is in. It's really important. And then the compassion, the support, and comfort is honestly what stands out a lot as well. I recall exactly the songs the anesthesiologist played during my surgery, the music. I recall the phone calls from them 12 hours later. I remember the countless visits from the specialists afterwards. I don't know, it's those types of details that really stand out and that I remember, and the tender care that I received. Please stop. And finally, patients really need the emotional and psychological help. Or just to be reminded that they're not alone. They need to be aware of the support groups and the postpartum resources for them. And I think some may not think that they need it right then, but may realize it later on, months later, years later. So I think it's just really, really important that they're aware that they exist. Next slide. And for patients and families, partners and families, giving them the privacy that they want, I think it's just incredibly important. I honestly thought it would have been better if somebody had been with my husband and son for those 3 hours and held their hands and, just got their minds off of things. But that's not what he wanted. He wanted privacy. He wanted to be alone. He asked for that, and that's what he got. And they listened to him, and they asked him what he needed, and that's, again, what he got. I always talk about empathy, not sympathy, trying to put yourself in their shoes, and especially when it comes to the reality of the situation, the reality is that the situation stinks. It really does, but that's the truth, and trying not to sugarcoat it at all, I think is really, really important for partners and families. And again, I think it's not just for patients, but the families and partners, they need to be aware that this experience can be traumatic, and they can feel helpless and not really realize that it can cause anxiety and PTSD, and that there are definitely resources available to them, reminding them that it's okay and they're not alone. Next slide. So here's just some resources and support ideas that I put together. As I look back, I really feel that there was a lack of postpartum resources shared with me. There certainly weren't any Accreta-specific resources shared. I honestly didn't even know that there were therapists available who specialize in birth trauma, and that there's physical therapists who specialize in adhesions massage and recovery from abdominal surgery. There's therapists, of course, that treat PTSD and anxiety specifically for moms. I was just completely unaware. And, of course, there's support for postpartum depression and breastfeeding and simply about my own self-care. One of the questions that I had after my hysterectomy is what type of medical doctor do I see long-term? Do I need to see a gynecologist anymore? I didn't have a uterus anymore, but I had no idea. I certainly didn't want to go back to my previous OBGYN because I'd be sitting in the waiting room with pregnant women. So would it be a family doctor? What hormones would I have to monitor moving forward? There were just so many questions and so little guidance. And at the time, in 2012, there were no Accreta resources. But now, 6 years later, there's the National Accreta Foundation now, just 2 years young. And we're building resources for patients and providers. And then there's a Hope for Accreta support groups on Facebook. There's a Heroes for Moms toolkit for survivors who want to host a blood drive and make it easy for them. And with these resources, it's actually helpful for the hospitals and the providers because, just an example, my doctor now shares these groups with the new Accreta moms in my hospital. And when they join the support groups, I can connect with them. They're local, and it's amazing that I get the opportunity to visit some of them in the hospital, and I can help guide them and mentor them through this complicated journey. And this is the support they need. These are the kinds of resources to get in front of the patients in hospitals. Next slide. And as I wrap up, I'll just invite you to connect with me and send me a message, questions about my patient experience. I really appreciate your willingness to listen and hear my story and what I learned. I'm 6 years out, but my near-miss experience is still fresh, and most of those details are still available to be shared, like most of them I shared today. Next slide. And finally, please connect with the National Accreta Foundation and follow us. We're really committed to raising awareness of Accreta and helping prevent future cases of it. And all women who plan to have children need to be aware of Accreta and involved and informed if they are at risk in future pregnancies. They need to be aware that a cesarean delivery puts them at risk for developing Accreta in a future pregnancy. And they really need to advocate for great care and make sure blood products are available to them. So I'll just conclude by saying thank you. Thank you for all that you're doing to help women like me and families like mine. It's amazing. Your skills and experience and empathy greatly, greatly impacts our recovery and outcomes. So thank you, and I'll take any questions.
Alexis, thank you so much for sharing your story. It's been really enlightening for us, like myself, as